Welcome to the Profit Trap Podcast, Health Insurance Industry Secrets, for anyone who will ever own or use health insurance in their lifetime. Health Insurance Information Alert. This episode, we will be covering escape clauses, the health insurance Houdini effect. Watch your healthcare coverage disappear. Escape clauses, the Houdini effect. This is one of the main ways some health insurance companies may get out of paying claims or denying them altogether. This is a list of some of the maneuvers health insurance companies could use to possibly avoid providing the benefits that you are paying for. We will cover all the escape clauses in detail over several episodes. Escape clauses, the Houdini effect. This is a brief list of some of the escape clauses the health insurance industry commonly uses. Dependency, change of primary income earner. Divorce, death, exclusions or limited or scheduled benefits, primary change of occupation to an ineligible occupation, participation in organized hazardous activities, health insurance plan approval underwriting at point of first claim and not when application for coverage submission occurred, misrepresentation by the insured at point of application. Out-of-network treatment. Policy premiums are not paid before grace period expires. You have had coverage lapse from one carrier to another and it expired. Medically necessary treatments are not approved by pre-authorization. Non-covered procedures, state residency changes, relocation to an ineligible state for coverage, non-eligible persons, and condition-specific deductibles. It appears the health insurance companies may spend more time on how to avoid claims payments instead of upgrading your benefit coverage to pay your claims. Escape clauses, the Houdini effect. Escape clauses we are covering in this episode: dependency change, divorce, death, and pre-authorization. Escape clauses, dependency change. A dependency change or primary income earner or primary on the policy in the household could be a claims escape clause used by the health insurance company to possibly deny claims or terminate your policy. Policies are not Mr. and Mrs. They are considered a primary applicant with dependents including your spouse. This means the primary income earner on the policy, usually the primary policy owner, is responsible for the premium payments. When that has changed due to medical issues or other reasons, this changes the perceived liability of the individual viewed as responsible for the health insurance premiums by the health insurance company and can affect the continued coverage of the policy and it being able to remain in force. Make sure that if this occurs in your family, to contact the health insurance company immediately and make sure the policy changes are made for the primary insured on the policy in order to avoid possible claims denial or termination of your policy, especially since in a serious medical tragedy is usually the reason a primary insured changes and could leave you without health insurance at all due to hidden claims escape clauses. Escape clauses, death. Death is another escape clause usually based on the primary insured and can have the same effect on the stability of possible claims denials and the policy staying in force as a dependency change does. Notify your health insurance company immediately about this or any other major changes to any insured, especially the primary insured on your policy. Otherwise, you could be faced with losing your health insurance altogether. When dealing with the loss of a loved one, you may need health benefits for yourself, as stress and emotional trauma may induce unstable health conditions to those suffering from a loss. The last thing you want to happen is to lose your health care due to an escape clause in your health insurance coverage. Escape clause, divorce. Handling divorce for insurance issues is usually set in stone. Normally, the primary insured is the owner of the policy, and the spouse is typically terminated from the policy when the divorce is granted, leaving the spouse to qualify for a new health insurance plan. Children may be exposed to having no coverage or qualifying for a new health insurance plan, as well if the primary insured or owner of the policy is not the custodial or biological parent of the children. Even if you have a good relationship with your future ex-spouse and you let them stay on the policy until they find alternative health insurance, claims are filed after a divorce is granted. The spouse claims most likely will be denied. The health insurance company may look at termination of the marriage or non-disclosure of the divorce as fraudulent claims action and may terminate the policy or deny claims for anyone covered on the policy. To avoid these dangerous escape clauses, inform your health insurance company immediately of any divorce, dependency change, or death. Escape clause pre-authorization. Pre-authorization for medical treatment in many health insurance policies is required with no exceptions prior to inpatient or certain types of outpatient medical care. If you don't do this, get ready for some additional out-of-pocket expenses, usually consisting of 25% cost, but may vary for the total charges for procedures you received. Some plans may have a maximum out-of-pocket penalty of $1,000, for example, and others may deny a claim altogether because approval was not obtained prior to medical treatment being received. Unauthorized organ transplants are almost always not covered. This is a way health insurance companies controls and decides the kind of medical care you receive, instead of allowing your physician and you to make these decisions. Almost always the health insurance company requests the physician to perform the least cost-effective procedure, such as an older procedure, less advanced medical procedure to maximize profits, but may cost you a longer and harder recovery time. In some countries, due to socialized healthcare, a vital procedure can take 6 months to be pre-authorized for approval and performed. This has been the Profit Trap Podcast, Health Insurance Industry Secrets. Weekly episodes every Sunday. Like us, follow us, share us, subscribe to us, and download us. You can find us on YouTube at Health Insurance Industry Secrets, Facebook, Health Insurance Secrets, Instagram, Health Insurance Secrets, Twitter, Health Insurance Secrets, and our podcast, Health Insurance Secrets. Get connected today so you don't miss any of this must-have, need-to-know information to protect yourself, your family, your assets, and your future.